everyone, my name is Manal and today I'll be presenting my paper on abortion in the United States. So just a little overview of the presentation. I'll be going over the introduction of the topic, a little background and literature review regarding abortion, some discussion looking over the data and information that we have from other countries. Then we'll provide some recommendations to the congressman. And lastly, we'll have the conclusion. So, what is an abortion? An abortion is a procedure to end a pregnancy conducted by a licensed healthcare professional by removing the embryo or fetus and placenta from the uterus. So there's a number of reasons why abortions are performed. They can be anywhere from preserving the life or physical or mental well-being of the mother. It can be to prevent pregnancies caused by rape or incest. It can also be to prevent the birth of a child with serious deformities or mental deficiencies or genetic abnormalities. Or it may just be for social or economic reasons. Now, how are abortions performed? There are a number of techniques and procedures that can be done for an abortion. They may be completed in simple clinic settings or in a hospital. In the first 12 weeks of the pregnancy, we can perform procedures such as endometrial aspiration, suction, or curettage to remove the contents of the uterus. From weeks 12 to 19, injections of saline solution may be used to trigger contractions to move the fetus. Hysterectomies may also be done to remove the uterine contents surgically. Additionally, there are various medications that can be used to induce abortions. As the pregnancy advances, however, there is a greater risk associated with abortions. In these cases, it may even put the woman's life at risk. So why is abortion such a big issue? There's ongoing debates regarding the ethics, legalities, and policies of abortions. But whether they're legal or not, or ethical or not, women still require access to abortion services, and it should be considered a human right. We see minority populations suffer the most from this issue. We also do not have adequate resources for abortions that are accessible for everyone. So, going into a little bit of background, we see on January 22nd of 1972, the United States Supreme Court announced a decision in the Roe versus Wade case, legalizing abortion in all states. But prior to this, only states legalized abortion to save a woman's life or in case of rape or incest or fetal anomaly. From this case, the Supreme Court declared a woman's right to make her own decisions about her pregnancy and recognized that it deserves constitutional protection and privacy. However, despite the Supreme Court's decision, abortion laws vary by state with some restrictions before viability for abortions. So we see, looking at the data, abortion rates have gradually been decreasing between 1980 and 2000. The total abortion rate decreased by 14%. We also see the rate of abortions for Hispanic women in 2000 was 872. The data suggests that women aged 20 to 24 years had the highest rate of abortion in 2000. We also see very limited access to services of abortion and restrictions. The lower rates of abortion may also be linked to fertility there is poor overall health in women of childbearing age due to the lack of health resources, unhealthy lifestyle, low health literacy, among other conditions. The use of contraceptives were responsible for some of the decline in unintended pregnancies as well between 2008 and 2011. We also see from 2010 to 2019, the number, rate, and ratio of reported abortions decreased by 18%, 21%, and 13% respectively. In 2018 to 2019, the total number, rate, and ratio of abortions increased by 2%, 0.9%, and 3% respectively. Women in their 20s compose the majority of abortions in 2019, like we saw before, at 56.9% and 92.7% of the abortions were performed at or before 13 weeks gestation. From 2010 to 2019, the use of early medical abortion increased by 123%. So we see here at this data, and we find that the unintended pregnancies and abortions worldwide are mainly affecting the low-income countries. We see the highest rates of abortion in the middle-income countries. However, in the unintended pregnancy rate, we see low-income countries. This data was provided by Guttmacher Institute. Now going on to a more specific area, the area of Texas, we see that in 2012, the abortion rate was highest for Black women and lowest for white women, with Hispanic and other in between. The percent decrease in the abortion rate was greatest for Hispanic women at approximately 25% decrease compared to the 16% decrease in white women. It was also noted that geospatial mapping demonstrated that over 50 Texas counties, primarily focused in West Texas, had a 75 to 100% reduction in abortion rate for Hispanic women. In 2017, there was also a 25% decline from 2014, with a total of only 35 facilities that provided abortion services, 21 of them being clinics. This is especially interesting as we know Texas has a very large population. Additionally, in 2017, 96% of Texas counties had no clinics that provided abortions, and 43% of the Texas women lived in those counties. So let's go on to the discussion with our Congressman Van Taylor. Van Taylor has co-signed two specific bills that are related to abortion. The first one being the no taxpayer funding for abortion and abortion insurance full disclosure. In this, we see that the bill prohibits the use of federal funds to be used for abortions or coverage that involves abortions. It also prohibits abortions being taken place in a federal healthcare facility. Additionally, he's co-sponsored another act, the Born Alive Abortion Survivors Protection Act. This was introduced to the House, and it requires healthcare practitioners to provide care to a child that is born alive following an abortion or attempted abortion. Now, in order to have a more equalized healthcare system with federal health insurance or healthcare coverage for all type of system, it's crucial to provide federal funding where needed. In the case of abortions, it is senseless to deprive women of funding for abortions if they are unable to afford the cost. It's also backwards to hope for and want an equal healthcare system without providing the resources and funding needed. So how are other countries handling the issue? Abortion rates are highest in countries that are legally restricting access to abortions, whereas in high-income countries where abortions and contraception are more accessible, the abortion rates tend to be lower. Canada has greater access and more freedom to utilize abortion services despite the global COVID-19 pandemic. In 1988, the Supreme Court of Canada abolished the law banning abortions for women to have access to abortion and healthcare services. In 1989, the Supreme Court of Canada ruled that only the woman who is pregnant has the right to make the choice of terminating her pregnancy, and no other individual had legal say in her decision. Now, although there are plenty of legal opportunities, major limitations we see is access to clinics in Canada. Many people are required to travel great distances in order to reach the clinics or hospitals that provide the services. However, through the COVID-19 pandemic, a lot of women are able to receive abortion services through telehealth with counseling and information on the resources. So recommendations for our congressmen. We can introduce a sort of Affordable Abortion Act. In this, we will give the right to abortion to women regardless of the reason. We can give women the needed funds for the abortion procedure. We can also provide them with resources for information, transportation, and access to facilities and information for the abortion. What do we expect to see from this new bill? We can see that the women will be able to exercise their rights and contribute positively to society. We can also see the elimination of health disparities among low socioeconomic status women and those that belong to racial and ethnic minorities. We can also see that physically and mentally healthier women can cultivate and grow healthier communities with greater health outcomes. In conclusion, abortion laws and viewpoints have evolved all throughout the world in the past few centuries. Specifically in the United States, regardless of the morals, ethics, and legalities, it is a service that many women require and have the basic right to. Our state of Texas does not provide equal opportunities for women to receive the services they need due to lack of resources, funding, and opportunity. Other countries in the world have managed to address disparities and discriminatory laws that prevent women from getting abortion procedures when they need. Texas may be able to benefit from similar policies and legislations by adopting similar approaches. By allowing women access and rights to abortion, we are able to provide a more just and equal healthcare system and in turn promote healthier communities and populations.